Okay, so welcome everyone to our Creating a Culture of Care Supporting Students in Distress training. Definitely excited that everyone can make it with us today. So let me move forward to introduction. So my name is Kevin Baldueza, pronouns he, him, his. I'm a student affairs case manager that supports the undergraduate colleges of Marshall and 7th at the moment. So if everyone can kind of, if you don't mind introducing yourself via the chat, we'd love to get to know everyone. So if you can share your name, the department or college that you work with, and the number of years of span of service here at UCSD, that'd be great. Or if you feel more inclined to, you can definitely unmute as well. Okay, I'm seeing Ayumi, 4th year in the sociology, this 3rd year TAing. Okay, thank you. Beatrice of sociology, worked as TA in MMW in the social department for 5 years. Welcome, welcome. Sophie, TA for social courses, post-martial writing program, 4th year at UCSD. Thank you, Sophie. Caroline, 2nd year in sociology department, 2nd year TA. I'm seeing Shevin, Department of Sociology, 6th year in the department, 4th year teaching, 1st year teaching as an instructor. Welcome. I'm seeing Adriana of Sociology, 3rd year TA. And if I mispronounce anyone's name, I totally apologize. Is it pronounced Kwai? Yeah, okay, perfect. So faculty, 20th year teaching sociology. Okay, thank you everyone for sharing. So let's move forward into our agenda. So this is a little breakdown of what we will be going over today. So I do want to share that this presentation is more than just information sharing. At some points it might require some participation via poll questions, breakout rooms, such as that. So this is what we're going to go over today. So we're going to start with the land acknowledgement, move into our learning goals, and then kind of go over what student affairs case management services are and what we kind of do. Moving forward into understanding our student population, and then going into recognizing a student in distress, how to identify steps in providing support to that student in distress. We'll go into resource sharing near the end, and then if time allows, we'll go into some application of skills and knowledge. Okay, so here's our land acknowledgement. So the UC San Diego community holds great respect for the land and the original people of the area where our campus is located. The university is built on the unceded territory of the Kumeyaay Nation. And today, the Kumeyaay people continue to maintain their political sovereignty and their cultural traditions as vital members of the San Diego community. And we definitely want to acknowledge them for their tremendous contributions to our region and thank them for their stewardship. Okay, so here's the first chance for engagement. So what does everyone kind of hope to learn or gain from this training? And again, you can definitely put that in the chat or you can unmute if you feel comfortable to do so.
I think for me personally, I just want to have more information about like what to actually do. We had kind of an intense incident this quarter, and I just felt really unprepared. So mostly just kind of figuring out what is available and what we should be doing.
Okay, perfect. Thank you for sharing, Ayumi. I'm seeing Sophie, how to provide more support for students than simply listing out resources. I hope to learn what students focus resources there are arena campus beyond that, beyond just recommending students to CCAPs, resources to help the students. Okay, so we'll definitely touch base on everything that everyone's kind of bringing up in the moment. So moving forward into our learning goals. So as a result of attending this training, we'll know how to recognize a student in distress. We'll know how to provide support to that student in distress. We'll know how to connect a student in distress with support systems here at UCSD, and we'll be, prepared to offer the best resources to support students in distress. Let me just check the chat. Okay. Moving forward into student affairs case management. So the main thing that I do want to point out is that we are a non-clinical resource for undergraduate, graduate, and professional students. We receive referrals from the Dean of Student Affairs of undergraduate colleges, and from the Assistant Dean of Student Affairs from the Graduate Division, to more so assist students who may need additional support in, managing the challenges of academic life. We definitely work closely with campus partners such as financial aid, the Office for Students with Disabilities, CAPS, to identify, what level of support would be best suited for the student who is in need of help. So in my role, we work within the colleges and collaborate with student affairs, academic affairs, res life as well, to kind of give you a glimpse of how many cases came through our office last academic year. There were about 3,451 students in distress, and about 381 of those students were referred to case management. So what we kind of do, we connect with students in distress through intentional one-on-one conversations, collaborate with campus services to provide resources to students in distress. We do training such as these for faculty and staff in regards to best practices in supporting students in distress. And then we assess current institutional practices, research, and implement best practices in supporting students in distress. So moving forward into understanding our student population a little bit better. So we did have a survey that it's a little dated at this point, but it was last academic year. So students, answered within the last 12 months of this survey. About 49.6% of our students stated that they felt overwhelming stress. 60.4% stated they had difficulties with procrastination. About 37.7% had difficulties related to anxiety. I'm not going to read everything, just the main points. So 26.5% had difficulties with depression. The ones that I really want to point out is at the bottom, where we had about 2% of students actually attempting suicide, and about 8.8% of students intentionally injuring themselves through, cutting, burning, bruising, and otherwise trying to, injure themselves. Okay, so moving forward into a little bit more of a mental health portion of this presentation. So students were asked how often they felt the following over the last 30 days. So I'm just going to read the top portion, the gray portion, which is most or all of the time. So about 15.5% of students who were in the survey stated that they felt hopeless. 31.2% stated that they felt restless or fidgety. 10.9% stated that they felt so sad that nothing can cheer them up. 28.7% stated that everything was an effort. 12.1% stated that they felt worthless, and about 15.5% stated that they felt nervous most or all of the time. Okay, so moving into our Kessler-6 scale. So this generates a score between 0 and 24, with higher scores reflecting higher levels of psychological distress and serious mental illness. And the scores were broken down into these different categories. So about 82% stated that they felt no or low psychological distress, which generated a score between 0 and 8. 29% stated that they felt moderate psychological distress, which they got a score from 9 to 12. And about 27% of the students stated that they felt serious psychological distress. So that generated a score from 13 to 24. Okay, so students were also asked whether they experienced a variety of problems or challenges over the last 12 months. And of those who reported experiencing the problems or challenges, they were asked about the level of distress that it caused. And it was broken down into these different categories. So the number one leading problem and or challenge was procrastination at 81.5%. The next one being academics at 66.8%, personal appearance, which was the third one at 58.2%, career being the fourth with 48.7%, and family issues at 44.7%. And about 80% of students reported experiencing 3 or more problems or challenges at the same time. Okay, so students were also asked about factors that have negatively impacted their academic performance within the last 12 months. And this was kind of defined as negatively impacting their performance in class or delaying their progress towards their degrees. And as you can see, there has been a significant increase in all of these categories since 2016. So I'll just read 2016 through 2021. So In 2016, stress was about at 33.9%. Moving into 2021, there was about it rose to 49.6%. Anxiety was at 24.1% in 2016, rose to 37.7% in 2021. Sleep difficulties were about at 18.6%, moving up to 27.4%. Depression was at about 16.1%, moving all the way up to 26.5%, and career and work-related academic impediments were at 14.5% in 2016 and rose to 19.1% in 2021. So you can definitely see that there's been a significant increase across the board. Okay, so in regards to chronic conditions, students were asked whether they have been diagnosed with the following conditions. Again, of those who reported ever being diagnosed, they were asked if they received care for the condition within the last 12 months. So on the left-hand side where it says percent ever diagnosed, you can see anxiety was the top one at 19.4%, and then depression being the second highest one at 17.2%. And again, the right-hand side of the slide is the percent of received care for these chronic conditions in the last 12 months. And about 14% of students reported diagnoses of depression and anxiety together. Okay, so here again is a little bit of a breakdown of our case reporting over the last academic year. And as you can see, mental well-being was by far the highest number at 718, academics being the second one at 401, and then family concern, basic needs, and physical health all kind of hovering around the same numbers. Okay, so now that we have some more information on our students' experiences, how do we kind of identify student in distress? So here, this is how we kind of define that. So it's a student in distress is a student whose academic progress or functioning in the university environment is adversely affected due to, a number of indicators that are, impacting their mental well-being and or the mental well-being of others. And students in distress definitely can exhibit multiple indicators across multiple different environments. And we'll discuss that pattern a little bit later. Okay, so here's another chance for engagement. So which are considered indicators of students experiencing distress? Physical indicators, academic indicators, behavioral indicators, emotional indicators, or unmet basic needs. And you can definitely put your answer in the chat or unmute. Sherman, yep, it's definitely all of them, and we'll go over each of them separately so we can kind of understand what they kind of look like. So the first one being physical indicators. So here are a few indications that someone is experiencing any kinds of distress. An example of this that you can imagine is a student lets you know that they're not sleeping very much, their appetite isn't what it normally is, and they're frequently experiencing, headaches or stomach aches. So these are some of the indicators that we've come across when working one-on-one with our students. So you might notice that they're extremely fatigued. You might notice a change of their hygiene or just poor hygiene. Changes in their sleep pattern. They might be a lot more agitated when they're speaking with you. There might be increased physical health complaints, such as continual episodes of illnesses, colds, flus, etc. So moving forward into academic indicators. So an example of this can be, a student intern who you notice is coming in late or missing work, and they're not as interested in things that normally excite them. So these, again, are some things that we've noticed when working with our students. So you'll definitely notice a drop in their grades. You might start noticing them avoiding participation in class, changes in their concentration, excessively anxious when they're called upon. Again, there might be excessive absences or loss of motivation to attend class. You'll definitely notice more poor performance and preparation for the specific classes. There might be repeated requests for special considerations or accommodations. You'll definitely notice a decline in the quality of their work. And the one thing that we do want to highlight on here is, noticing any kinds of disturbing content in their writings or presentations or just anything like in, class related. Okay, moving forward into behavioral indicators. So an example of this could be a student emailing you excessively demanding you to do a regrade or change their grade on an assignment or exam. And, we've definitely noticed this in our students. So increased procrastination, they might present with self-harm. You might start noticing that they're withdrawing from their friends and family and just the UCSD community in general. Again, they might become excessively demanding of others. They might start neglecting their personal hygiene again. They might become a lot more irritable when they're speaking with you. Again, excessive dependency, increases in impulsive or risky behaviors. And this is a huge red flag for us right here, noticing any kinds of violent acts towards themselves or others. Okay, so moving forward into emotional indicators. So an example of this could be a student lets you know that they are feeling extremely stressed out and report feeling anxious about their commitments and has come to feel, hopeless about anything improving. So again, these are some things that we've noticed when working with our students. There might be a change in their mood. They might be frequently tearful when you're speaking with them. They might present with SI or suicidal ideation. Again, they might be increasingly agitated when they're speaking with you. They might have expressions of hopelessness, fear, or worthlessness. There might be high levels of anxiety or feelings of panic. And there might be unprovoked anger or hostility towards themselves or others. Okay, so in addition to indicators, students also have to manage their basic needs. So I'm just going to go over the right-hand portion. So you might notice a student has a lack of housing, which is a big thing for us right now. You might notice a student, they might tell you that they're couch surfing with friends or they're living out of their car. Um, a lot of our students are having food insecurities right now, so they might have to choose to skip a meal to, buy something else, maybe a textbook or whatever it may be. There'll definitely be some financial struggles, so they might not be able to make their rent payments or not be able to afford prescription copays for their medications that they do need. So these are all different things that we've noticed when we're working with students when coming across any kinds of unmet basic needs that the student has at the moment. Okay, so in addition to all the indicators and challenges, some of the students have intersecting and cross-cultural stressors. And here are a few that our students may be, experiencing as they continue to complete their degree at UCSD. And a few examples that some of us may be aware of is, international students sometimes are taking courses or classes in English where that is their second language and might have difficulties understanding sometimes. Um, there might be stresses from the country of origin or stresses from the political climate in the US right now, or even their country of origin. And, even just the model minority myth of the assumption of students of Asian descent do not need support because they're fine and they're the majority here on campus. So again, these are some of the cross-cultural stressors that we've seen. So navigating host and academic culture, the student might have little local or US support. We might notice the students start to, socially isolate themselves from the community. Again, there might be language barriers. There may be cultural variations around symptoms of psychological distress. Again, might be political stressors from the US or their country of origin, and or differences in spirituality, and then definitely intersectionality between all of the different identities that the student does hold. Okay, so here's another chance for engagement. So why aren't students seeking support on their own? So definitely you can unmute or you can put it in the chat. Chat. So Caroline's saying lack of knowledge about resources, stigma against using them. That's definitely a big one. Saying the university is enormous and bureaucratically labyrinthine, and students know of long wait times, demands of documentation, etc. Sometimes they don't know what support exists, or they feel embarrassed, unsure of when to seek help. It is hard to seek support when you are distressed. That's definitely a big one. Maybe they feel like they can handle it without help. A lot of our students do try to traverse all these different things by themselves. Some think it's normal to be stressed or anxious. Okay. So everyone pretty much hit everything on the nail. So these are the barriers that we've seen. So stigma being, a huge one. So even asking for help can be viewed as stigmatizing, specifically for mental health reasons or basic needs reasons. Again, there might be a lack of information. The student may not be aware of, the purpose of the Dean of Student Affairs or the Assistant Dean of Student Affairs, or even my role as a Student Affairs Case Manager. Um, Students may not be aware of what campus resources are available to them. Students may also not be aware of the various levels of confidentiality and or privacy resources that are available to them, or they might be, even afraid that the information that they share would get out to other people. There might even be some fears of their family finding out. So sometimes, this occurs when students are sharing their parents' health insurance. There might be a fear of impact on their academic or permanent records, or background checks, and this oftentimes happens when students are applying for grad school. So these are all the different barriers that we've seen, but there's definitely other barriers out there that stop students from seeking support on their own. Okay, so now that we are familiar with identifying students in distress, we will now go into identifying steps to provide students the support that is needed. Okay, so some of you may be familiar with the term red folder. So most institutions use this folder to kind of identify common signs of students in distress and direct faculty and or staff or graduate and teaching, research assistants through campus protocol to clarify who they should contact in the event of emergency. So we've kind of broken down the folder. So you've learned the first half of the folder earlier, which were the indicators. So we'll start with, you've identified with indicators of a student in distress, moving forward into connecting and supporting that student with resource referrals, if that is possible. And then ultimately, if you still have the concern with the student, definitely calling the Try and Concern line. So the Try and Concern line is monitored 24/7. That is their number right there, 858-246-1111. This line is not deemed for situations of emergency or any kinds of safety risks. So a safety risk could look like physical violence, dangerous behaviors, suicidal behaviors, threats or violence towards others. That is all emergency situations in which you would definitely want to call 911 or UCPD. So for those who work within the colleges, you should definitely follow your own internal protocols to connect with the Dean of Student Affairs. If you are not working with the college, you can definitely call the Try and Concern line. So the Try and Concern line is intended for staff and faculty use only. So therefore, we ask that you don't share this line with students. Students have definitely called before. So if the students were to call the Try and Concern line, they would be assisted, but would ultimately be referred to contact the specific campus resource that is needed. Again, the Try and Concern line is not for situations of emergency, but more so for notification, follow-up, and or consultation about the student. If it is a safety risk, again, you can call UCPD or 911, but you can also text 911 if that's, easier or more safe for you at the moment. But again, calling 911 is the fastest way to get emergency services to the student. However, texting may be a better option if you are hard of hearing, nonverbal, or have difficulty speaking in the moment. If you're in a situation where it's not safe to call 911 for help, or if you're having a medical emergency and cannot speak on the phone, you simply just put 911 in the number field or the to field, and then texting your location, the nature of the emergency, and the dispatcher with the agency serving the area that you are texting from, for example, UCPD, will respond with questions and instructions. We definitely do want to acknowledge that calling UCPD is not the most inclusive practice in getting a student support, especially for students, UCSD students who have experienced any kinds of police brutality. But we're definitely in talks of creating more of an inclusive practice. And we hope to share that in the coming year. Okay, so this is a little bit of a breakdown of what happens when you call the Try and Concern line. So first, a staff or faculty calls the Try and Concern line about a student in distress. That ultimately gets routed to a third-party service that we utilize called Protocol, who receives the call and routes the concern. And then the last two happens within 1 business day. So Student Affairs Case Management follows up with the caller via email if the caller wants a follow-up, and then the student may be connected with support resources following that. And this is a little bit of a email example of if you were to ask for a follow-up regarding the student that you made the call about. Okay, so moving forward into our Try and Concern form. So this is definitely another resource that is available to faculty, staff, and students in the which is the Try and Concern form, which you can find on the front page of our Student Affairs Case Management website, which is the URLs right there. So this form, again, is for non-urgent concerns about a student's well-being. A concern may include any kinds of circumstances or behaviors that may interfere with the student's ability to function in the living and learning environment successfully. We do want to note that no concern is too big or too small to report. All submitted concerns will be reviewed and routed to the appropriate area of campus for follow-up as necessary. So some examples of what to report may include a student experiencing a decline in work or academic performance, missing class or activities, demonstrating disruptive behaviors. They might, if you come across a student who comes across as sad, anxious, or experiencing any kinds of dramatic mood shifts, feelings of hopelessness or helplessness. Again, a huge disclaimer is that this reporting form is not monitored 24/7 like how our Try and Concern line is. So if this is an emergency or you may need immediate assistance, we definitely want everyone to get in the practice of calling UCPD or 911. So any kinds of examples of emergencies would include, threats of harm to themselves or others, preoccupation with violence, or, if they have engaged in violence prior, preoccupation with weapons, if they have access to weapons, mentioning plans for violent or destructive events, or any kinds of emergency situations. Yeah, let me just check the chat real quick. If a student is having a panic attack in the class, should we call Try and Concern line? You can definitely call the Try and Concern line, but if the student is having like a panic attack in the class in the moment, I would try to remove them from the class and kind of speak with them outside, and try to calm them down, maybe even have someone walk them over to CAPS urgent care. I think that would probably be best practice. Okay, so moving forward into the different types of behaviors that we've seen. So we've broken down the behaviors into 4 categories. So mild, moderate, elevated, and critical, so that we can address each of them separately as they have somewhat of a different response. And you'll definitely notice a lot of crossover with a lot of these. So the first one being mild disruptive behavior, which is generally passive. The student may or may not know that they, or even realize that they're impacting others due to their behavior. So an example of this could be a student arriving consistently late, consistent interruptions in class, again, poor personal hygiene, trouble fitting in or adjusting to college life. If the student, starts to alienate themselves with their thoughts and mannerisms. So some interventions for mild disruptive behavior would be, to meet with the student individually, kind of reiterating, office or classroom expectations of the student, referring the student to appropriate resources if that is needed, and then definitely wanting to communicate your concern, through the appropriate dean of student affairs and or calling the child concern line. Moving into moderate behavior. So moderate disruptive behavior tends to cross more so into active and intentional acts. So examples of this could be, difficulty coping or adapting to their stressors. Their behaviors may subside if the stressor is removed. Situational stressors that cause disruption in mood, social or academic areas. They may be managing chronic mental illnesses, mild substance misuse, disordered eating. They might become frustrated when speaking with you and storm off or start to disengage, and may even, in this behavior, they might even start, creating signs or trolling on social media. Interventions for this would be, again, reiterating the expectations of the students, in the classroom or the office, reaching out to the student to encourage a meeting. You might even want to include others in your response to this student. So maybe your supervisor or the director, refer the students to appropriate resources or student involvement opportunities. And you definitely would want to communicate your concern to their dean of student affairs and call the child concern line as well. And let me just check the chat. To initial suspects, student who was acting strangely in class, and then freshman through class and was clearly not quite connecting with reality. So to answer your question, Martha, so we receive our referrals directly from the Dean of Student Affairs for their specific college. So I think you did the exact, right thing that to do. So connecting them with their Dean of Student Affairs. And you could definitely call the child concern line regarding the student. And I'm seeing another question. I wonder what are recommended practices for getting students consent when reporting these kinds of concerns. So again, that really does fall under privacy, which will fall under, we'll definitely go over that in a future slide. So moving into elevated behavior, which is a gradual escalation with possible threats of violence and ultimatums that may be vague but direct, or specific but indirect. So there may be a fixation or a focus on a target, which often emerges. So it could be a person, it could be a place, it could be a system in place. The individual, continues to attack the target's self-esteem, public image, or the access to safety and support. So an example of this could be, again, difficulty, adapting to their stressors. There again might be some situational stressors that cause disruption in their, mood, social, or academic areas. Again, they might be managing chronic mental illness, substance misuse, everything like that. So the intervention for this would be, again, reiterating the expectations of the student. You definitely would want to, encourage the meeting with the student, have someone else involved with this, again, maybe a supervisor or a director. And again, referring the student to appropriate resources on campus, more student involvement. And you definitely would want to, connect them with their dean of student affairs and call the child concern line. Moving forward into the last type of behavior which we've seen is critical. So these are violent and or threatening behaviors that are happening in the moment right now. So the only intervention for this is to call UCPD or 911. So if you feel unsafe to call 911 or UCPD, try to get the attention of another staff member to call for you, or have the other staff member wait with the student while you make the call. If you feel that the student may, run away, you definitely want to take a mental note of their physical appearance and what they're wearing, so that you can kind of describe that to the police. We do want to make a huge disclaimer that it's never your responsibility to follow or find a student. So again, the only intervention for this is to call 911 or UCPD. So an example of critical behavior could be direct or physical threats of harm to self or others. They might display a firearm or a weapon. There might be physical violence or threats of violence towards themselves or others, or there might be cases of harassing or stalking of, students, faculty members, staff members. And let me just check the chat. If a student shows up to class under the influence or some sort of substance, would that be considered an elevated risk? That is definitely, I would say that that would fall under that. If you do notice a student who is under the influence, I think the best practice would be to ask them to step away from the class, and then again try to encourage that meeting with them and kind of figure out what's going on with the student. But I think to remove the student, if you notice that they are under the influence, to remove them from the classroom setting for that day. Okay, so moving forward into communicating levels of support. So sometimes when a student approaches you and discloses that they're having challenges, we might be caught in the moment, or we might be at a loss for words. So therefore, we definitely want to share or go over a few practical methods of communicating support. So sometimes students ask, is this confidential, or don't tell anyone, or I need to tell you something, but I don't want other people to find out. Right. So as university employees, we all do fall under some sort of privacy or confidential laws. So in my role, and I would assume majority of university employees fall under the Family Educational Rights and Privacy Act, or FERPA. So FERPA allows university employees to communicate with other university employees when there is a concern for a student or a legitimate educational interest. So an official has a legitimate educational interest if the information is relevant and necessary to fulfill professional responsibilities or duties related to the student's education, discipline of the student, a service or benefit for the student, the evaluation of the student's academic performance, maintenance of campus safety and security, and any action or interest relating to the planning or execution of the university's academic, administrative, employment, or financial programs. Let me see. So we also do want to emphasize that we can honor a student's privacy, but not confidentiality unless you are a confidential service. So let's move forward with that portion. So if a student wants to have a confidential place, these are the available resources. So like how a lot of us fall under FERPA, a lot of these places have their own privacy laws that they fall under. So these are places that you can call and give all the information to regarding a student, knowing that if the student has not signed a release of information, they cannot reciprocate any information back to you. So we have the Office of the Ombuds, we have Student Legal Services, we have CARE at SARC, we have CABS, and we also have Student Health Services. So all of these different resources fall under their own confidential laws. Okay, so here are a few phrases that we, recommend using to refer students to resources or other support systems. So you can say something along the lines of, additional support resources are available to you. Your college can be a place of support. The Dean of Student Affairs of your college can help you explore more options, or I can help you connect with other resources. Okay, so another chance for engagement. So what are some resources that everyone is aware of that can help students in distress? And we kind of already went over a couple of the confidential resources. And if those are some of the resources that you already know, please, put that in the chat or feel free to unmute. Okay, I'm seeing CAPS, Basic Needs Hub. There's definitely a lot of resources on campus. And again, that might be a reason why some students might not seek out support on their own, because there are definitely a lot of different resources available to students. OST, that's a big one. So basically, like in my office, CAPS, basic needs, OSD, we're in communication with each other every single day regarding students. Okay, so let's move forward into some of the resources that are available to students. So some of you mentioned the hub. So the hub is a great place for students to get support as far as their basic needs. So they can get assistance with applying for CalFresh. There's different financial and food resources available to students. The China Food Pantry is a huge one. Um, as far as accommodations, someone brought up the Office for Students with Disabilities. That's another big resource for our students that they oftentimes utilize, almost every single day. If a student has specific needs, specifically international students, we have our International Students Programs Office, or ISPO, where our international students can get, support in their visas or work-related stuff or financial support. We have recreation, which have youth camps and programs. The zone that has food demos, health promotion programming, different stuff like that. So we have a lot of different resources that are available to our students that can help with not just their basic needs, but a lot of other things. We also have great campus community centers. So these places, we definitely point students in the direction of if they are feeling that they need a space for community or resource or guidance from their peers. So we have a lot of different campus community centers such as Apimeta, Try and Transfers, the LGBT Center, the Women's Center, the Undocked Center. So these are all great resources that you can point students in the direction of, again, if they are feeling that they need more community or resource or guidance from their peers. Okay, so we're nearing the end. So here's another chance for engagement. So when I become aware of a student in distress, I should inform my dean or assistant dean of student affairs and or call the try concern line. True, false, or maybe. And again, you could put your answer in the chat. I'm saying a true, a couple trues. I'm saying a maybe. Okay, so I definitely just want to apologize up front. This is kind of a trick question. So the answer is maybe. So if you remember or recall in a previous slide, if you're working within your own department and you have your own internal protocols, you definitely want to follow that first before, calling or consulting with the dean or calling the check concern line. You definitely want to follow your own internal protocols first. And for the interest of time, we have a few case studies that I'll just read through and we can kind of go over what we would do, to help support that student. And let me just look at the chat. Is there a document that lists all these resources so that we can have it on Canvas or syllabus? There is a website that have all the different campus community centers. As far as all the different like confidential resources and stuff like that, I don't think there is a specific list, but I can definitely send out the slide deck to Sophie if you'd like, and then you guys can share that amongst each other. So let's move forward into the first case study. So I'll just read through this. So hello, the case study is DJ. So hello, Kevin. You have not responded to my email from yesterday. It is very important you regrade my final today. If you don't help me with this, I won't be able to graduate, get a job, or get into grad school, and this is all because of you. I have massive student loans piling up. Have you not received my previous emails? I need you to respond today. I'm losing patience. This is extremely unprofessional of you not to respond when not doing so impacts my life. If you do not respond to me immediately, I will file a complaint with the chancellor. Thanks for nothing, DJ. And I can only assume that some of us have received emails along these lines from different students. And there's definitely a lot of things, within this in this email that is being sent to a campus employee that there are like red flags, right? So this is how we would kind of follow up with this specific student. We would want to contact the student and discuss this with your supervisor. You definitely would want to call the try and concern line because there were some ultimatums in the email and stuff like that. So this is definitely, it's definitely warranted to call the try and concern line in regards to this student. The Dean of Student Affairs may respond if you have asked them or if they need more information. And the Dean of Student Affairs may reach out to DJ to set up a meeting to kind of determine the next steps. They might even be referred to someone like me, like a case manager. Let me just check the chat. Okay. Moving forward into our next case study. So CJ is a 25-year-old fourth-year student who lives off campus. You have met with CJ a few times throughout their time at UCSD, and when CJ comes to meet with you this time, they seem a little disheveled and tells you that they are very stressed out and reports that they have been living out of their car for the past month and hasn't had enough to eat on a daily basis. So there's a lot of things going on with CJ. Again, this is how we would kind of follow up with CJ. So ask the students if they are aware of the Trine Food Pantry or the hub. Inform the student that the dean may reach out to the student and briefly explain the dean's role or their support role. You definitely would want to call the Trine Concern line in regards to this student. The Dean of Student Affairs will respond again to you if you would like, if you've asked for a response or if they need more information regarding the students. The student most likely would be referred to someone like me, a student affairs case manager, who I would be able to support the student with getting them connected with these different campus resources or different off-campus resources, or even just discussing natural supports such as family members or friends. And I believe this is the last one. So Katie is an 18-year-old first-year student who is living on campus. While talking to Katie in your office, they report that they are having a very difficult time adjusting to life at UCSD. Katie has not been doing well academically since starting school and has had some suicidal thoughts. Katie also reports that they are not making friends and doesn't get along with his suite mates. So there's definitely a lot of things going on with this specific student. Um, this is how we would follow up with the students. So we would ask, Katie, if they can be safe, or it feels like, if Katie were to state that they would harm themselves, we definitely want to call 911 as that they're a risk to themselves. We would want to explain the role of the dean, who would definitely want to reach out to Katie and, explain their support role. This one is, you definitely would want to call the Trine Concern line if the, how do I say this? If the suicidal ideation is not, if they're not intending on harming themselves or they don't have plans on harming themselves, if it's more passive thoughts, you definitely would want to call the Trine Concern line. The Dean of Student Affairs will respond to you if you ask for a response about the student or if they need more information regarding the student. The student may be referred to someone like me again, a case manager, who would help them in getting connected with a CAPS provider, or getting them connected with the Office for Students with Disabilities and or other resources on or off campus. We would definitely want to get the student connected with their academic advisor or dean of academic advising from their college. And or connecting the student with off-campus providers, mental health providers, or different programs such as like IOPs and stuff like that. And let me just check the chat and let me stop record.